All right, so my presentation for tonight is titled More Than Meets the Eye, and given away, it's about eyes. So I'm going to talk you through a little bit of what it is that we're looking at when we're examining eyes as veterinarians, and then some common things that we see go wrong with eyes. So, as Kirby gave me a nice little introduction, I'm from Ontario. I graduated from the Ontario Veterinary College and have been here at Urwash as an intern for the last few months. My hobbies outside of just eventing with my horse that's not very useful these days include cooking and baking as well as hiking. So you can see here, this is the cake that I made for one of the vets in our last clinic before he headed off to help the Olympic team with some stuff. So what's the worry when it comes to eyes? So eyes are a very sensitive structure. We always are concerned because it can escalate quickly and lead to visual impairment, which can certainly be distressing for the horse as well as the owner. There's also a lot of tiny structures that can get quickly affected that can cause a lot of pain in a horse's eye. Just a squinty eye can actually be very painful, even though it might not appear that way. There's also a lot of nerves involved in the area of the eyes. They can show signs of other neurological diseases, but can also just affect other parts of the horse's well-being. So, sort of a brief anatomy of the eye, just so we know what we're talking about here. The outside of the horse is looking towards the left, and the inside towards the back of my optic nerve is inside the horse's head. So on the outside we have their eyelids, which are covering up that nice globe. The most outside portion of our globe, that big white line, that would be our cornea, which is often a part that gets affected if they get something in their eye, if they scratch it. Then in the middle we have that lens separating two parts of the inside of their eyeball, and then at the very back we have their retina with their optic nerve, which is where their actual vision takes place. So as we go through evaluating eyes, we look at a few different things. We always tend to start by looking from the outside, doing an external exam, seeing what we can see grossly. And then we move on to doing an exam of some of our cranial nerves. So this can help us assess, can the horse feel what's happening around its eye, can it see, and can it move its eye? And then we can go on to pull out what we call our direct ophthalmoscope, which is the little machine with the light that we use to look into their eyes. We can also then consider putting some stains in their eyes to show us some different things, as well as doing things like a nasolacrimal duct cannulation, which is where we take a little catheter and pass it up through the nasolacrimal duct in their nose, which I'll show you later to explain better. Some other additional diagnostics that your veterinarian might recommend, but aren't done as commonly, might include taking a culture, like a sample from the eye to do culture or cytology, as well as what we call a shimmer tear test, which allows us to look at how much tear production the horse has. Or even if you had an ophthalmologist, you might have something as special as an intraocular pressure measured. So starting looking from the outside of the horse's eye, if you have a keen eye here, you can tell that there's a fly sitting on this horse's lower eyelashes, but otherwise it seems to be a very normal eye. It's nice and open, his eyelashes are pointing outward. We can be concerned if the eyelashes are pointing more down towards the eye or even somewhat rolled in on themselves. We also are looking for things like the color of the eye and whether or not there's any swelling present or perhaps a laceration or another part of trauma. The next thing we go on to do would be evaluating some of our cranial nerves. There's a lot of different tests we can do, but these are some common ones that we tend to do all the time when we're looking at eyes. So the first one is what we call a menace response. This is where we take our hand and we sort of gesture towards the horse's eye to see that they blink in response. This one isn't a reflex, so the horse has to know that this is happening, they have to know that they want to blink. So when you do this to a foal, they won't necessarily respond because they haven't learned to yet. Whereas when you do it to a full-sized horse, they tend to. Although sometimes we do have to actually touch their eyes to make them realize we might, or actually threatening them to make them blink. Another one we can do is when we take our light and we shine it in their eye and look at their pupil, we want their pupil to constrict. If their pupil doesn't constrict, then maybe they have an issue either with their eye being able to see that we're shining that light or with the actual signal making them constrict their pupil. So we can look at that in both eyes, and this one's kind of cool because we can actually do it to one eye and we should see the other one constrict too. And then the other one we look at commonly is what we call our palpebral. So again, this one's a reflex, so the horse doesn't have to consciously know that this is happening, but we touch around their eye and even sometimes the base of their ear, and we want to see them blink. So that lets us know that they're able to feel around there, and they're also able to move the structures around their eye. So while we're talking a bit about nerves, we also have the ability to do some anesthesia when we're doing our eye exams, and this can help either a horse not necessarily feel what we're doing, or sometimes can make our exam go easier. So I've got 3 different needles around this horse's eye, which I know look a little odd, but if you look at the blue and the pink one up to the one side there, those ones are in what we call our palpebral nerve block. So what those are doing is stopping the horse from closing its eye on us. So this can be important if we have a really painful eye. We don't want to have to force that eye open. So instead what we can do is anesthetize this nerve with some lidocaine so that the horse isn't fighting us so much so that we can do a really good exam of their eye. The lower yellow one that's in there is actually for what we call our supraorbital block, and what this does is it decreases sensation to that eyelid. So let's say there was a trauma to the eyelid and we want to suture it up, that might be a reason that we would go ahead and block that so the horse wasn't feeling it as much. In terms of that little alkane bottle sitting next to it, that's also an eye drop that you would typically see, and the reason we use that one is we drop those drops into the eye, or sometimes you'll see us put it into a syringe and spray it into their eye, and that actually anesthetizes the cornea itself. So that way, when we're touching the cornea, so that outer layer of the eye, it's not disturbing the horse as much. So then we go on to use our fun little gadget, the direct ophthalmoscope. So this has a lot of different functions. We have different colors of lights that let us see different things, as well as different sizes of light, and then it can also have the ability to change the focus. So this lets us look at everything from the outside right to the back of the inside of the eye. One of the other functions it has is a slit lamp, and this can help us look to see if there's anything sort of floating in the liquidy parts of the eye. So we might see under the cornea if there's anything, we kind of get like a shimmering effect, or you can see stuff floating in that chamber. So kind of an idea of what we're actually looking at the very back of the eye. What you're seeing here is 3 completely normal but totally different looking pictures of a horse's fundus, or the back of their eye. So that salmon-colored oval in the back, that is their optic nerve. So these ones all look nice and healthy, they're round, but we'd be looking to see, are there any like bites taken out of them or extra material around them? And then coming off of those, there's lots of fine little blood vessels, and we want those to look nice and fine. It's normal that there's none towards the bottom of these optic nerves, but we want to make sure we're seeing that they're not looking abnormal, they're not bigger than they should be, stuff like that. And then you can also see that the eye has 2 different colors at the back of it. So the top part is the shiny part, we call it tapetum, which we want to, again, similar to that, the top and the bottom, we want to make sure that they're not like abnormally colored. There aren't spots of maybe hemorrhage or like spots where we can see blood in there that they shouldn't be. So there's lots of different things we can see in there, but there's also lots of variations of normal. So we have to be aware of all the different options. Sometimes the difference in pigment at the back of the eye can be similar to the difference in pigment of the horse itself. So then when it comes to, after we've done all of our outside exam of our eyes, we might want to go ahead and put some stains in. So these help us to detect either foreign material in the eye or scratches in the cornea and things like that. So the top one that I have here, the yellow, that's the fluorescein, which you've probably seen us use commonly if we are concerned for an ulcer. So the reason we use this one so much is because it doesn't like, or it likes structures that like water. So the outside of your cornea doesn't uptake any of it, and the very inside layer of your cornea won't, but the parts in between will. So we're able to see if the outside membrane of your cornea has been scratched off, that then we can see how big that scratch is and how much of the eye is affected. We do have other stains, although we don't use them nearly as commonly, such as the rose bengal, which is the pink one. It can be used on its own, or we sometimes use it after the fluorescein stain. And what it does is stains dead cells, or defects in the tear film, or can even help us look for really small foreign bodies. So this one is back to talking about that nasolacrimal duct cannulation that I mentioned earlier. So I put it following our eye stain because we have this duct that goes from the corner of the eye and comes out at the bottom of the nose. And when we put stain in the eye, that's one of the tests we can do to tell whether or not this duct is patent. So after 5 to 20 minutes after this stain has been put in the eye, we should be able to see some of that yellow or pink pigment showing up in their nose. If we don't see that, or if the horse has signs like tearing or staining around their eyes or a discharge in the medial acanthus, so the bottom sort of front corner of their eye, those can be signals that for some reason this duct isn't open. And if it's not open, then we can stick one of these catheters in it and we can flush it out to help open it back up. So now that we've talked a little bit about what it is that we're looking at in eyes, a little bit on what should you do if you have an eye emergency in a horse. So first off would be that ideally do not put anything in the horse's eye. They're very sensitive structures and there's a lot of information we want to collect before we decide what we're going to put in their eyes, whether it's from looking in their eyes or doing those stains to know what's safe for their eyes. Other things would be not to force their eye open. If they have something in their eye, you don't necessarily want to push on it and maybe cause more damage, which is reasons that we have things like the blocks we can do to let us open their eyes more safely if we need to. And then the other thing would be not to let the horse rub their eyes. When the horses have something in their eye, inevitably they want to rub it and it can easily make the problem worse. So in that case, placing something like a fly mask on them can help to stop them from causing any more trauma to their eye. And of course, in the do list would be call your veterinarian and get some more advice, as well as if you need to clean around the eye with anything, we recommend just like a plain saline because a lot of detergents and stuff can be harmful to those very sensitive structures within the eye. Now that we've talked a little bit about what we do, how we evaluate eyes, I just wanted to cover a few common things that we see with eyes in this area and just in general in equine practice. So potentially most common, or at least most common I've seen so far, would be corneal ulcers. So this occurs when there's damage to that outside corneal layer of the eye. So this can occur if you have a trauma, maybe you've got a piece of foreign material in the eye, or there's been an infection present that's just caused that outer layer to become damaged, and now some of the inner layer of that cornea is exposed. So, as I talked about earlier with the stain, we would go ahead and use the fluorescein stain to detect this. This then allows us to decide what we want to use to treat it. When the ulcers are very small and new, and we think that they have a good chance of healing well, we might just talk about putting them on an antibiotic, whereas ones that have been going on longer, or we perceive there's other issues at hand, we might also talk about using things like serum, which is where we actually spin down the horse's own blood and pull off the serum to put that in their eye. That has been shown to have some effects to stop the collagenase, so it's stopping the breakdown of the sort of scaffolding in that cornea that would then cause the ulcer to potentially get bigger. We're stopping that from happening so that it doesn't do that. And then we might also consider things like a pupil dilator. The reason we do this is when eyes get painful, horses very typically constrict that pupil really tightly, and that can cause issues with the eye itself long term, as well as is associated with pain. So we do our best to try and get that pupil nicely dilated. Depending on the severity, other things that might be considered too would be an anti-inflammatory, either taken systemically or put topically in the eye. As ulcers also progress, it's possible that you have some where they start to heal over, but the edges of it don't adhere properly. And then we might look at doing something like debridement, and that allows us to make a nice healthy edge around that ulcer so that it has a chance to heal over properly. Some horses, when they have ulcers, require medications really frequently, or some just aren't very good for taking their medications. So there are systems we can put in place to help with that. Although it looks a bit archaic, it's just that there's a bunch of tape pieces braided into this horse's mane to hold this catheter in place. And what it does is allows us to administer eye meds from back towards the horse's withers so that we're not right up in their eye. So another issue that we can have with eyes is what we call conjunctivitis. And that's when the tissues around that eye, like you can see here, get all reddened. Typically, this can happen by itself, but it often commonly happens too with other conditions. Unfortunately, I was struggling to find a picture of just conjunctivitis on its own, so this horse also has a giant ulcer in its eye, and we'll just ignore that for the purpose of this presentation. So again, because it often happens with other conditions, we want to do a complete ophthalmic exam and figure out, is there any other cause for this conjunctivitis? Are there any other things we need to treat? Because typically what we need to treat in order to cure the conjunctivitis is whatever underlying cause caused it. So we typically do stain these eyes with fluorescein to make sure that they don't have an ulcer, because that can affect what medications we can and can't put in the eye, and also determine what other treatments we might need. So treatment for this one involves a lot of plus minuses based on what's going on, but these typically get put on some antibiotics, even if it's just prophylactically, as well as some systemic anti-inflammatories. And then very at the bottom of the list, if we're absolutely confident there's no chance that there's an ulcer, we can consider putting topical steroids in there. But unfortunately, those have to be monitored closely, because if you're putting steroids in and there gets to be a scratch in the eye, steroids can make that bad much more quickly than they would on their own. Another thing that is commonly seen in horses is squamous cell carcinoma. This is the most common cancer of the eye nexus, so the tissues around the eye. Although this is a quite severe case, usually what you're seeing is just maybe a change in pigment or a small lump around that corner of the eye. And this does commonly happen, like it's seen here, over the third eyelid, because it happens a lot in non-pigmented areas of the eye. So there are some breeds that are predisposed to things like this, which include breeds such as drafts, Appaloosas, paints, thoroughbreds, and halflingers. However, in some of those breeds there is some genetic testing I discovered you can do, but typically what the recommendation is, if you have a predisposed breed or someone that's got non-pigmented skin around their eye, would be to use a fly mask that protects against UVA and UVB radiation, because that can often set off these cancers. There's many ways, the best way to diagnose this, other than just based on appearance, to confirm it would be to take a biopsy and do what we call histopathology. It's when we send it off to the lab and they send us back a report telling them what they saw under their microscope, which is super handy. But once we get to that point, or even sometimes without having to send off that sample, if we're fairly confident just looking at it, then we look at treatment. So treatment for these can involve a variety of different things, including taking it out, or what we call excision, as well as things like cryotherapy, where they freeze these, or use chemotherapeutics. Some of these chemotherapeutics might be like what we call cisplatin beads, so a small local chemotherapeutic that we can put in place. Another common issue with horses' eyes is a condition called anterior uveitis. So this has a variety of causes and is actually the leading cause of blindness in horses. But the causes can include many things, such as trauma, infection, or often are even unknown. There are some breeds, like Appaloosas, which are predisposed to this as well. But the infectious causes are much less common. In order to diagnose this, it's usually done based on our ophthalmic exam. If you are seeing an ophthalmologist or someone who has the ability to take an intraocular pressure, this can also be an important part of diagnosing this, although we can make this diagnosis based on just the appearance of the eye as well in some cases. But typically when they have that case, their intraocular pressures will be decreased. So commonly when you have anterior uveitis, the biggest problem with it is that it can cause acute blindness, which can, if we treat it, can sometimes be resolved. However, a lot of the things that occur because of uveitis can also then lead to issues with sight long term. So uveitis can lead to things like issues with the cornea, where they collect edema and become more opaque. Horses can develop glaucoma or cataracts, and even sometimes see hemorrhage within their eyes, or detachment of the retina, which is that part of the eye at the back that we were looking at before, which allows them to see. So some of the things we might see when we're diagnosing this on our exam include things like pain, they're tearing a lot, they have an eye they're holding closed, or they're even not wanting to be in the light. A lot of these horses are quite sensitive to light. And then in terms of our treatment, there's a variety of things we might consider using. Again, we can consider using steroids, but to do that we would want to make sure there was nothing else going on with the cornea, like I talked about earlier with staining, to make sure that we don't have an ulcer that we're going to make worse. As well as, similar to earlier when I talked about dilating the pupil due to pain, we want to do that again in these cases, as well as provide topical anti-inflammatories, as well as systemic anti-inflammatories and often even antibiotics. And there is a surgical treatment that can be used in recurrent cases of uveitis, where they put in what we call cyclosporin in a slow-release formula that helps continually treat these conditions. And then last but not least, we have trauma to the eye. So this can come in any number of forms. Horses love to hit their faces off of things, and whether it means that they lacerate that eyelid, they might cause a laceration within the cornea itself or that outer layer, or they might even fracture the bones around their eye or cause a puncture into those tissues. And all of those tissues are very sensitive, so these are things we want to look at as soon as we can. Things like eyelid lacerations can be repaired quite well. However, they need to be repaired in a manner that makes them still functional, because horses still need that upper eyelid. As much as we can save it, we try to do our best. So depending on the type of trauma that they've sustained, we do a bunch of different diagnostics, which might include palpating around that eye to see, are the bony structures involved, what all are we feeling, and where's the swelling coming from, things like that. As well as we might consider taking x-rays to evaluate those bony structures, or even ultrasounding the eye. So we can actually ultrasound through the eyelids and assess a lot of the eye structures. So also depending on what sort of trauma we might diagnose, the treatment may include things such as repairing that. If it was a laceration, maybe we can suture it up. If it was causing a lot of inflammation, we would probably put these horses on anti-inflammatories systemically, as well as oftentimes they might need an eye lubricant, because if their eyelids aren't shutting properly and able to fully cover their eye, they're at risk, unfortunately, for things like corneal ulcers forming. So we have to keep those eyes good and protected. And then other ways to get some of the inflammation out include things like cold compresses. So last but not least, in a thing about ophthalmology, I have to include enucleation, because I feel like to clients oftentimes it's a big scary thing when we talk about taking eyes out, because horses seem like they really need their eyes, but unfortunately there's a lot of horses whose eyes become very painful, and they actually do great once they have their eyes taken out. So I've included these pictures from a short discussion that was actually on our website from a horse that had its eye removed a few years ago. So you can see that right after the surgery they're bandaged up, and then the eyelids are sutured closed, and then over time the socket, typically you see it like sink in, but these horses do really well like this. So this is often done when horses have ongoing discomfort with their eyes or inability to treat the condition that is going on. So sometimes we have horses where we just can't get on top of the ulcer that they've gotten because they might have other underlying factors contributing to that ulcer, and sometimes enucleation is the best way to help these horses out. I did include a little snippet from a study here at the bottom just because I thought it was interesting. I know a lot of people have a lot of concerns when they go into considering enucleating one of their horse's eyes, and I thought this was interesting because it talked to 119 owners of horses in the UK that had their eyes removed, and 77% of those horses were able to go back to their level of performance that they were at before having their eyes enucleated, and that was including horses that were like in the higher levels doing sports like eventing and jumping and even racing and stuff. So these horses still can have a very good life afterwards. And it was also interesting that they talked to the owners about how they felt their concerns were addressed, or how many of their concerns they felt were really necessary after the surgery, and 90% of them noted that the things that they were concerned about before surgery didn't end up being an issue at all, and 21% even said that they wish that they would have enucleated their horses earlier because they realized how much better their life was afterwards. So with that, does anyone have any questions? Yes?
The anterior uveitis,
Mm-hmm.
does that typically just occur in one eye or both eyes?
So it can occur certainly in both eyes, depending on what the predisposing factor is. We might see it in one eye first and then the other eye. Some horses will also only ever get it in one eye, but it tends to depend on what was the underlying cause of it.